on the platform. Dr. Kamini will join few seconds late. Just a sec. I will invite you, then please, then share. So we would like to welcome you all with the topic Reviving Fertility through Ayurveda. First time, I would like to welcome Dr. Rachna H.V., Professor, Department of PTSR, Sri Sri College of Ayurvedic Science and Research, Bengaluru. Welcome, madam. Welcome on the platform. And I would like to communicate my gratefulness and regards to Professor Kamini from Vadodara, ex-professor from All India Institute. So thank you, Rachna ji. Now I would like to invite you as you for blessing us. Rachna ji. निशान जी नमस्कार, डॉक्टर मेहर जी नमस्कार, मैडम नमस्कार, डॉक्टर रचना भट्ट जी, am I audible to you? Dr. Rachna ji, yes, great, वेलकम. आपके दर्शन नहीं हो रहे हैं जी, नहीं. आपकी आवाज नहीं आ रही है रचना जी. निशांत जी थोड़ा देखिए ना.
रचना जी,
हेलो.
yes, you are audible.
Hello.
Madam. हाँ,
Sir,
बोलिए,
are you able to hear me now? Are you able to hear?
Definitely loud and clear.
Okay, sir. Okay.
Please
I
continue.
was unable to hear from that side.
Yeah. You are audible, madam.
Okay, sir. Okay. Can I start, sir?
Yes, welcome. Kindly continue. Welcome.
Okay, sir. Okay. So, namaste all. I am Dr. Rachna, professor in the Department of Prasuti Tantra and Stri Roga, Sri Sri College of Ayurvedic Science and Research Hospital, Bangalore. I am working since 15 years in the same college. And so I'm very happy to be a part of your seminar today. And special thanks to all the organizers and Dr. Kamini madam for giving me an opportunity to present this presentation. And today's topic is reviving fertility through Ayurveda. So, motherhood is a joyful moment in every woman's life. So, becoming mother is a dream of every woman. And nowadays, in the OPD, we can see out of 10 patients, 5 to 6 patients will be come with a complaint of infertility. The reasons may be various, sometimes it is unexplained also. So, infertility has become a major issue in the reproductive age. That is why so many, even the fertility centers are also blooming up. In one road we can see 3 4 IVF centers are blooming up in especially in Bangalore cities like Bangalore and multiple metro cities. So that is why so much importance is being given for this topic, because it is blooming very fastly, and it has become an even a commercial point of view also. It has turning very badly by the allopathic people. So that is why reviving fertility through Ayurveda. So how we can help for the patient. So that is very important. Whatever the science has improved today, but still there is the success rate is only 30 or 40% with artificial reproductive techniques. So that is why Ayurveda plays a very important role for this Vandyatva or infertility conditions. So the factors which are responsible for the conception, as we all know that Rutu, Kshetra, Ambu and Bija, it is very important. If any problem with any of these factor, maybe Rutu as a Rutukhala or Kshetra, the reproductive system, if any problem is there, and Ambu we can consider as a Rasadhatu and Bija is the Artava or the Shukra. If any problem is there, any of this thing, then definitely it will lead to the infertility or Vandyatva. Rutu here we can consider as the Rutu Kala. So that is Dwadasharatrat iti Shodashadineshu Madhye. Adhyam Dinatrayam Antimam cha Shodasham. Yoni Sankocha Dinam na Ghananiyam. So the Rutu Kala, the fertility period, because many people they are unaware about the Rutu Kala. They are especially with the village people or the workers, so they are not having any knowledge related with the fertility period. So we have to counsel for such kind of patients. So the Rutu plays a very important role. So if the conception has to taken place, means they have to be in have a contact during the time of Rutukala, then only the conception will happen. And Kshetra here we can consider as the complete reproductive system. It may be the endometrium, it may be the fallopian tube, it may be the ovaries, or any problem with any of the organ part of the reproductive system, then definitely there will be difficulty for the conception. And Ambu here we can consider as a Rasadhatu. If Rasadhatu is in a proper condition, then Uttarottara Dhatus will be in a proper condition until Shukra Dhatu, it will nourish us. So the Ambu is very important for the conception. And Bija, that is nothing but the Artava and Shukra, that should be also of a good quality. So then only the conception will happen. If any problem with any of this, then definitely there will be a difficulty for the conception. Being Ayurvedic doctors, what we have to understand that we have to think which out of these four factors in a patient comes to us, which factor is having a problem, whether the Rutukala is having, or the Kshetra, or the Ambu, or the Bija. So based on that, we can plan and we can diagnose properly and we can give the proper chikitsa. And even in the causes of infertility also, they will explain, the modern science explains, it may be because of the ovarian dysfunction, or the tubal disease, or the uterine factors, or the cervical factors, or the pelvic factors. So any one of these out of all these things, maybe sometimes 2-3 factors will together involve, or sometimes only one factor will be there. But if we see the modern science also, the causes also, see that all it has been told in Ayurveda. So ovulatory dysfunction we can consider as a bija dushti, tubal factor or uterine factors we can consider as a the kshetra dushti, and the cervical factors and the pelvic factors we can, if the rasadhatu nourishment is not proper, then there will be even the cervical factors and the pelvic factors also involved. So whatever it is told in the classics, the same causes has been explained, and we can see practically in the modern science also. And the factors essential for conception, not only from the female side, even the male factor also very important. The healthy spermatozoa, and the motile spermatozoa is required, and the under cervical factor capacitation and acrosome reaction is required, and ovarian factor, the ovulation should happen every month properly, and tubal factors, the patency, the tubes should be patent, then only the conception is possible, and endometrium, that is the, it should be receptive for the implantation. So if all these functions, all these organs are functioning properly, then only the conception will happen. If any problem with any of these things, then there will be difficulty for the conception and it may lead to infertility. So the infertility, even it is considered as karmaja vyadi, because whatever the science may have improved, but still we can see many unexplained infertility. So unexplained infertility, nothing but it is a the karma of the papa karma which has been done in the purva janma, all that the effect can be seen in this present life. So that is why the infertility, especially the unexplained infertility, we can consider as a karmaja vyadi. And when the any of the treatment is not responding, conservative treatments and the conventional therapies, the based on the doshas what we will going to treat, so it, if it is not having any effect, then it can be considered as a karmaja vyadi. And according to Harita, there are different types of Vandyatva has been explained. So Kakavandya, Anapatya, Garbhasravi, Mritavatsa, Balakshaya. So in all these things, there is one or the other involvement of either Rutu, Kshetra, Ambu and the Bija. And Vandyatva, here in today's presentation, I would like to explain the Hetu, Linga and the Aushada. So that is the Chikitsa. So mainly the Vandya, in many of the Yoni Vyapaths, we can see the Lakshana of Nashtartava. That is nothing, Vandyam Nashtartavam. So there will be absence of menstruation, there will be the absence of ovulation we can consider. So in many Yoni Vyapaths, we can see the Yoni Vyapath Vandyatva will be one of the main complaint, maybe in the Putragni Yoni Vyapath, Vamini Yoni Vyapath, Shandi Yoni Vyapath, Suchimuki Yoni Vyapath, Asruja Yoni Vyapath, Acharana Yoni Vyapath, Prasramsini Yoni Vyapath. So in many Yoni Vyapaths, we can see this Vandyatva as a main complaint. And in the classics tells that if the Yoni Vyapaths, if it is not treated, it may lead to Vandyatva also. And the one, because of the Yoni Vyapaths, certain Yoni Vyapaths, they are having the Lakshanas of this Vandyatva. That is why whatever the Nidanas which are told for Yoni Vyapaths, all that can be considered for Vandyatva Nidhana. It may be the Mityachara, Artavadushti, Bija Dosha and Dhaiva. So any one of this cause will be there for the Vandyatva. So if Mityachara is not done or Artava Dushtis are not there and Bija Dosha, that is the ovulation, the semen analysis, everything is perfect, then finally we can consider that Daiva is involved in the infertility of that particular patient. And Mityachara. Mityachara, it is nothing but what we are following in our day-to-day life. So we are more exposed to the radiation. We are nobody now, even without half an hour or 1 hour, we will not be there without using the mobiles, right? And the exposing to the pollutions and using to continuously, especially the software engineers, whole day they will be with laptops. So all this is radiations, and this will definitely have a effect on the fertility. And exposing to the pollutions and improper eating habits, obesity and eating disorders, smoking and drinks, and socioeconomical factors, and not but not least last but not the least is stress. Stress is very common nowadays. Whoever will come to us with infertility, so if we ask them, do you have any kind of stress, they will tell, yes ma'am, I have so much of stress, because stress is one of the factor which is causing the hormonal imbalance. So it will be the HPO axis will be impaired completely with the stress. And impact of junk foods, so there are the adipose tissues because of excessive eating and junk foods, so which will have a effect on the ovulation and menstrual cycle. So adipose tissue or fat tissue converts androgen into estrogen, and in very thin produces less potent estrogen, and obese are more potent for the estrogen. And the adipose tissue stores steroid hormones in obese, which affects on the HPO axis. So nowadays even we can see very small children, young girls, 13 14-year girls, they are very obese. So the junk food is one of the main cause in them. And they are not aware what and all the hormonal changes will happen in the body, but we have to guide them properly to avoid the junk food like pizza, burger, and all, which is not good during the puberty time, and even for the reproductive age. So I'm not telling that completely it should be avoided, but taking more frequently is not good. So that counseling we have to do for the, especially with the infertility patient. And exposure to the synthetic estrogen, that is called as xenoestrogens. Xenoestrogens is nothing but estrogen mimicking compounds which are not produced in our body structurally or functionally, which are related to estrogen, so which are bind to the estrogen receptors. So, for example, what pharmaceuticals products may be there, and beauty products may be there, the powders, creams, all that is nothing but the synthetic estrogens, and pesticides, coolants, and food preservatives. All this contains the xenoestrogens, which are not good for the body for taking a long time. But there is no actually no options, one or the other way we are using all these things. So food, anyway, all the preservatives they will add nowadays, whatever the food they are we will use. So even for the rice, even for the wheat, whatever it is there, they will add the preservatives. So all that contains the xenoestrogens, which indirectly, which is affecting the fertility of the population. And the smoking, all of you know that it will lower the sperm count, and smokers which they are having the lower acrosin activity levels, which helps to reduction in the acrosome, and thereby it will reduce the sperm count. And the alcohol consumption, so it also affects the HPO axis and the reproductive impairment, and this will increase the oxidative stress at the pituitary level, it will increase. And in males also it will lower the sperm quality and motility, and all the semen parameters, and even it reduces the FSH and LH level. And next Mithyachara, what usually the people are doing is the stress. They will take for small things also. They will take so much stress, and sometimes it is unnecessary. And the nowadays the people are the generation is very sensitive, and that's why we can see more of suicidal tendency, everything. So it may be the stress may be because of the social, physical, and the psychological things. So And because of the infertility only, there will be more of stress patients usually will take. So because of stress only, there will be the impairment in the HPO axis. So social pressure may be there because of the diagnosis, because of the treatment, because of the desires, and even the cost. So everything, emotionally, psychologically, the patient will become weak, and for each thing she will or he will take stress, that also impact the fertility. And then the weight obesity. So a body weight more than 20% of ideal age is considered as obese, and BMI, if it is ranging between 25 to 29, is considered as a overweight. And most of the women seeking infertility treatments are obese and abnormal level of reproductive hormones, which will lead to the hormonal changes in the body, and even it will be associated with the diabetes, cholesterol, heart disease, insomnia, many things, and it indirectly it will lead to even infertility also. And in a people with overweight, their agni is very weak. And following Mithya Ahara and Vihara, there will be a Tridosha Prakopa. And because of the Tridosha Prakopa, there will be Jataragni Dushti. And it will have a Ahara Rasa is not formed properly, and there will be Ama Rasa Utpatti will be there, and do access in the circulation, and which will cause abnormality with the Rutu Kshetra, Ambu and Bija, and finally it may lead to Vandyatva. This is how usually with the obesity people, the reason of Vandyatva or the Samprapti will be like this. And even the age also matters. Nowadays we can see usually in the olden days, at the age of 18 or 20, the girls used to marry. But nowadays, at the age of 30 also, they are not ready to get married. So at the age of 30, if any patient comes to us with the menstrual irregularities or some other issues, if we ask them, are you married? No, ma'am, I'm yet to marry. So I'm very busy with my career, and I have joined newly for the work, so I have to settle there, and after 2 years I will think about that. So by that time she will be already 32 years. So the as the age progresses, the quality of the egg deteriorates, and aging even which will increase the oxidative stress, and in the male sperm DNA fragmentation will happen, and it will damage the mitochondrial. So indirectly, the age is also a factor for infertility. So and even the egg quality which will come down as the age progresses, the quality of the egg will come down. So in the younger age, the quality of the ovum will be good, and as age progresses, the quality will decreases. That is why whatever in olden days they were following at the age of 20, within 25, usually the girls used to get married. So that is the ideal time. uh, but whatever it is told in the classic, practically nowadays it is not possible at the age of 16 years, and according to Sushruta, and for males 21 years. Practically nowadays it is not possible. At least within 25 years, better to get married and plan for the conception. So nowadays we can see at the age of 35, at the age of 38, they are planning for conception. So that is definitely which will have an impact on the fertility, that we can consider as the bija dushti. And the environmental factors like the heavy metals, zinc, copper, vehicle exhaust, which contains the anti-estrogenic effect, which is also having a effect on the fertility. And the pesticides, and the spouses of agricultural workers indirectly work with the use of chemicals, which will lead to the miscarriage, stillbirth, and the spontaneous abortion. And as I told earlier, the electronic media, magnetic resonance, like mobile towers, mobiles, Wi-Fi, laptops, all this will definitely have an impact on the ovaries. So the electromagnetic resonance, which are emitted from the cellular phones, can cause decrease in the ovarian follicles. So thereby the quality and the quantity of the ovarian follicles will decrease. So even it will increase the oxidative stress and endocrine disruption also. So the oxidative stress which negatively impact on the oocytes and impairing the quality on which is reducing the fertility, and which will even cause the DNA damage and keeping the laptops for quite a longer time, maybe 3 hours, 4 hours, it may generate the heat. Some electronic devices which will generate the heat, and prolonged exposure to the temperature, especially to the pelvic region, can affect the ovarian function and follicular development, and potentially leading to the infertility. So these are the mithya acharas we are following, we are seeing with the infertility couples. So the next cause is the pradushta arthava. So that is the, for understanding the pradushta arthava, we should know the shuddha arthava. Shuddha arthava, that is masa nishpicha daharti pancharatranu na eva ati alpam artavam shuddham adishet. Masan, it should come regularly every month. Masa is 28 days. So it should come within with a regular interval of 28 days. It should be devoid of the burning or the pain, and the stickiness should not be there. And it should stay for, the bleeding should stay for 5 days. And na eva ati, na eva alpam. It should not be excess also. It should not be very less also. So some patients, they will be having 10 days bleeding or 12 days bleeding, and some may have only spotting or just 1 day bleeding will be there. So that is all considered as a, it is not considered as a Shuddha Artava Lakshana. So in Shuddha Artava, it should come regularly within with the 28 days of cycle, and it should be devoid of the pain, burning sensation, and it should stay for 5 days. So you have to assess the patient. When a infertility couple comes you have to assess the Shuddha Artava Lakshana and the Shuddha Shukra Lakshana. So then you can decide where the problem is there. So Shuddha Artava, assessing the Shuddha Artava is very important. If any of this is not in a proper condition, then definitely you can decide that she is having a Adushta Artava. Many a times nowadays we can see the patients are having irregular cycle. They are getting their cycles once in the 40 days, once in 50 days. So that is not Shuddha Artava Lakshana. And some patient, they will be having severe abdominal pain during the time of menstruation. That clearly indicates that there is a Vata dosha impairment in the body, and there is a Shuddha Artava Lakshana is there. And it some patient will tell, I have only 1 day bleeding, ma'am, I have only spotting. So it is coming in a regular interval, but I am getting only 1 day bleeding. So that is also not Shuddha Artava Lakshana. So assessing the Shuddha Artava Lakshana in a patient with a complaint of infertility is very, very important. So you can decide where is the problem. So you can tell whether without any investigation, no need to send for any of the hormonal profile. If she is having a Shuddha Artava Lakshana, it is clearly indicates that her hormone profile is normal. So without the normal FSH, LH, or estrogen, these lakshanas will not be there. So no need to send for any of the investigation if she is having a Shuddha Artava. So if any impairment with the Shuddha Artava, then you can send for the investigation. And while explaining, our acharyas explained when in all the Artava Dushti, the Upadrava which is Vandhyatva. So Ashtartava Dushtis we know. So the Ashtartava Dushtis which is not treated properly, then it will lead to the infertility or the Vandyatva. So Ashtartava, when the Shuddha Artava Lakshana is not there, then it is considered as a Artava Dushti, and which will lead to Vandyatva. Prajotphatane Asamartha Bhavanti. So she is unfit, is incapable of having a baby. And Bija Asamarthanam, the quality of the egg will not be good. The vitiated Artava, it is incapable of producing the progeny. That is what our acharyas told as a upadrava of Artava Dushti is Vandyatva. Next is a Bija Dosha. So Bija Dosha, the definition of Vandyatva itself, it is telling that Bijam Pradushyanti, Vandyam Nashthartavam, Nashthartavam Vidyat. It is mentioned in Sushruta Uttara Tantra. So Sushruta has mentioned Nashthartava when there is an absence of ovulation, that is considered as an ovulation. So that is nothing but the Bija Dushti. So when there is a Bija Dushti, then definitely it will lead to Vandyatva. And even Bela and Madhavakara also mentioned that Artava is Nashtartava. Vandyatvam Nashtartavam. So here Nashtartava can be considered as absence of ovulation and absence of menstruation also. So if ovulation is not proper, then the menstrual cycle also will not proper in many a times. And that is understanding the Artava. Next, at the same time, the importance of Shuddha Shukra Lakshana is also very important. So with only one hand clap will not happen. So both the hands come together, right? So if there is everything is proper with male female factor, if there is a impairment in the male factor, then also there will be a problem for the fertility. So assessing the Shukra Dushti is also important. Shukra, psychologically traumatic factors may be there, and diabetic also many times, which will lead to the male infertility. And it may be because of the Ahara Sambandita, Vihara Sambandita, and Manasika. So taking Ati Ushna Lavana Sevana and Ruksha Aharas and Adhyashana, overeating, and taking only one type of food. So all this can be lead to the Shukra Dushtis. Related with Vihara, Vedadarana, Ratri Jagarana, Ati Vyayama, and which will lead to Apana Dushti. So that also will lead to the Shukra Dushti. See, nowadays in IT companies, IT people, so whole night, many a times, night shift they will do. So their biological clock is completely impaired because of that. So that all can be, which will lead to Apana Vata Dushti, and which will lead to infertility. And Manasika, that is Chintana, Shokha, Bhaya, Krodha. So all that will really will lead to Rasavahastroto Dushti, and which will lead to the male infertility. So in the today's era, we can see that taking junk food, oily food, very spicy food, deep fried items, all this we can consider as a ahara sambandhi, which is told in our classics, and which will lead to the Shukra Dushti, and it will lead to the infertility. So the Samprapti, what we can understand is because of the Nidana Sevana, there will be Vatadi Dosha Prakopas, which will lead to Jataragni Mandya, and because of that, there will be Dushita Narasa, which will enter into the Dhatu Vahastrotas, and which will cause the Dhatu Parinama and poor nourishment of the Shukra Dhatu, and leading to the Shukra Dhatu Dushti, and further it may cause problem with the fertility. The another main important cause, which especially I believe in my practice, that is Daiva. Daiva is very important, and especially with the unexplained infertility. So I have seen many patients, they have conceived with Daiva Vyapashraya Chikitsa, and I will show the cases in this presentation. So Daiva can be considered as anything which done in the past, and that karma, as I told earlier, the it is infertility is karmaja vyadi, and it is true also, and that is why our acharyas has been given so much importance for daiva vyapashraya chikitsa in case of infertility. And we will get a historical references also, in case of in Garbha Upanishad, in Bhagavata Purana, in Garuda Purana, in Manusmriti and all. They have clearly explained what karmas will lead what. So if in the past life, if any putra himsa is done in the present life, there will be recurrent pregnancy loss or unexplained infertility will be there, and causing pain to a pregnant woman in the past life will lead to delayed conception or inability to conceive. That is what in Devi Bhagavat Purana they have given. And destroying the sacred rituals related to garbhadana or childbirth, which will lead to infertility with no organic cause. And go brahma hatya, which is done in the past life, which will have a we can see in the present life uterine fibroids or conception due to the tubal block and due to doshic imbalance. This is what in Garuda Purana it is given. And Stri Shapa, which will lead to unexplained infertility, which is mentioned in Atharva Veda. So even in the Ayurveda Brihatrayas also, we will get many of the references related with Daiva and Daiva Vyapashraya Chikitsa. And even Kashyapa Samhita, in many places, we can see that there is a reference of the Daiva. So, in while explaining Rajasvala Paricharya, they have told before, prior to Maithuna Karma, the need to pray the God, and uh, even the Go Brahmana also has to be do the puja prior to Maithuna Karma. So many the Daiva Vyapashraya Chikitsas has been explained in our classics. And yes, Jataharini is related to infertility. Yes. So the grahas or the grahabadas we can consider, and even in our classics also there are references. Pritha Pushpam is mentioned, which is related to an ovulation. And when there is no ovulation, no corpus luteum, absence of progesterone, and no secretory endometrium. So this we can compare with the luteal phase defect. And in many Jataharinis, we can see that there is abortions, first trimester abortions, and the ectopic rupture, and many related with the infertility like Andagni, Pushpagni, Mohini. So these Jataharinis, which we will get the references, which is lead to infertility. And even the repeated stillbirths, that is the Nagini Jataharini and Vashya Jataharini. So that is also we can consider. And the Chikitsa we can do is Daiva Vyapashraya Chikitsa, Yukti Vyapashraya Chikitsa, and Sattva Vajaya Chikitsa. The first importance has been given to the Daiva Vyapashraya Chikitsa when it is considered for the infertility treatment, because it is Ashu Vyadhi Haram. You can see the immediate results with Daiva Vyapashraya Chikitsa. That is why it is placed first. And under Daiva Vyapashraya Chikitsa, we can do the mantra, Aushada, Mani, Mangala, Bali, Upahara, Homa, Niyama, Upavasa. So there are different kinds of Daiva Vyapashraya Chikitsa. So that all depends on the patient convenience, depend on the astrology. So we can tell which Daiva Vyapashraya Chikitsa will suit. And mode of action of mantra chikitsa. So you may wonder how the mantra, homa, bali, upavasa will help in case of infertility. Definitely it will help. So the action of mantra will be there on the atma and manas and the panchendriyas. So everything is having a vibration. So mantra chanting vibration within the body of the individual is completely synchronized with energy represented by the mantra, and it leads to scattering the positive energy within, and it is also having a healing effect. And there are many articles also we can see where there is a action of the mantras, homas, which will have an effect on the fertility and the stress level also. So the homas which will energize the chakras and which will purify the mahaprana, and stress level also will come down with the homa, and it will having a psychological, physical and social value also it is present. And the homas, the smoke which they are using, which will have a better brain blood flow through the internal feedback mechanism, and it will even help to reduce the stress level also. And upavasa, it is different types of upavasas are there: nitya upavasa, naimittika upavasa and kamya upavasa. So whichever is convenient and whichever the upavasa which the astrology will tell, so accordingly the couple can follow. So sometimes the jyotishyas they advise every ekadashis they have to do the upavasa, and before doing any yagna, one day prayer they have to do the upavasa, that is called as kamya upavasa. So scientifically also it is proved with many articles that they will tell that, so this upavasa which will improve the follicular development, oocyte maturation, and it will enhance the AMH levels, and it will balance the hormones. So that is how the upavasa which will help for the in case of a infertile patients. So, as the infertility is considered as a karmaja vyadhi, so this daiva vipashraya chikitsa, which will have definitely, which will have a effect on the bija bhaga and bija bhaga vaya dushti, which was affecting because of the purva janma krita papa karma. So, definitely, this daiva vipashraya chikitsa will help. So usually, after asking the astrologers, so I will suggest the patient. So I will when the patient comes. I will ask. I will give usually first 3 4 months the medications, and if the conception is not happen, then I will send for a astrologer, and usually they will suggest to visit some of the temples, or doing small rituals, homas or pujas. And usually the temples which I used to send for the patients which are having a which will have a effect for the fertility is the Naga Puja they will do in Kukke Subramanya and Arka Mahaganapati temple, which is present in Karnataka, and Shani Mahatma temple near Nelamangala, and Halavu Makkala Tayi temple, Kota, Santana Gopaleshwara temple, and in one more Santana Gopala temple near Mysore. And so there are different in Kerala, Tamil Nadu. This is a place of Mannara Shila in Kerala. So it is also having a mm, great importance, and many people will visit in this place, and they will do the Naga Puja, and after that many of the patient they have conceived. And in Kerala, other than Mannara Shala, even Guruvayur temple and other temples also, uh, it is having the divine effect related with fertility. And in Tamil, especially the Garbha Rakshambika temple, usually that is also the divine place to get the blessings for the infertility patients. And in Andhra Pradesh, Kalahasti temple. So this Kalahasti temple also, it is having a great power, and many of my patients they went and within 6 months or within 4 months they have conceived. So even I was surprised, even with tubal block cases. One tubal block case was there. So they have the modern people, they told IVF for that patient. And another tube was partially, it was open, but completely it was not blocked. Partially it was open, but they lost all the hopes, and they came, and finally I sent for an astrologer, and he advised to visit Kalahasti temple. And yeah, miracle it is, I don't know, within 3 months she conceived. And even the Kamakya temple in Assam, it is also very famous for the divine blessings. And I have some of the case reports also. This is a patient of repeated abortions. So the married couple, married life of 7 years, and they were having the miscarriages. So I had given them the Shodhana with the classical Virechana and Kalabasti. So after 3 months, she conceived, but it was aborted within 3 months. And even then afterwards, again I prescribed her some of the medications, Shodhana and the Shamana Ushadas. Again she conceived, but it got aborted again in the third month. And again, after 4 months, again she conceived, and it was a spontaneous abortion. So she didn't take any medications during that time. Then again, she came, and I asked her to go for an astrologer. And they told to do, she is having a Sarpadosha and the Grahadoshtis, and they advised her to go to Kalahasti temple and do Rahu Ketu Puja. And medications also conceived, and after 2 months again she conceived. And presently she is 26 weeks of pregnancy without any problem. So usually all the first three abortions she was having within 4 months. Now she is on her seventh month. Everything is fine. This is one example for the Daiva Vyapashraya Chikitsa. And this is another case with a primary infertility, where a couple of married life of 6 years, male partner seminal analysis was normal, and female partner was having anovulation due to bilateral PCOD. And Yukti Vyapashraya Chikitsa, the Shodhana and Shamana Chikitsa was given, and no dominant follicles even after treatment of 6 months. So she was taking treatment of continuously for 6 months, and counseling also done as a Sattva Vyapashraya Chikitsa. And so after 6 months, then I asked her to consult one astrologer. So he told she is having a Shani dosha, and then they told her to visit Subramanya temple for 9 weeks. So, and to do japa, Subramanya japa for 9 weeks. So, patient conceived after 2 months or after 3 months, and it was confirmed by early pregnancy scan. And in 2025, I conducted a delivery for her, and she delivered a female baby, and baby is fine now. So this is another case. And another case with married life of 8 years, and her AMH was 0.13. So usually nowadays we can see with a low AMH, usually they will advise IVF. So they had given her two options. One is you have to adopt a baby, or you have to go for a donor egg. This was the option given for her. And she doesn't want to go for adoption, and she even doesn't want to go for donor egg. She came to me. I advised her the Shodhana Chikitsa, that is classical Virechana was done, the Shamula Kshirabasti was done, and Uttarabasti was done with Shatapushpa Taila, and Shamana Aushadhis was given for 3 months. So, along with that, Sattva Vajaya Chikitsa was also done repeatedly, and along with that, together. So, for this case, together we did everything. So, as soon as she comes, she was totally frustrated. She was not ready to take any medication or anything. So, directly I send to see the astrologer. So they advised her to go to Garbharakshambika temple. And along with that, she has taken all this Shodhana and the Shamana treatment. So after 2 months, conception was the UPT has come positive, and in 2023 she delivered a male baby, and baby is fine. So she was about to adopt. She was also booked for. She was thinking to book for the adoption. So, but she doesn't want adoption. But in her relative and all, they were suggesting her to go for adoption. So she came to take the opinion. So I told her, you can try our Ayurveda for at least 1 year, and then the last option always it will be their adoption, so you can think about adoption. So then she tried our medicines along with the Daiva Vyapashraya Chikitsa, and she conceived, and she was also surprised. So Ayurveda can do miracle like this. She was very much surprised, and now she is very happy. And another case with the PCOD and the cervical polyp. So in that patient also, and male partner was having the grade 1 varicocele was also there. And so I advised them Yoga Basti and Uttara Basti, and along with that they did Santana Gopala Mantra Japa also, and the patient conceived and delivered a healthy male baby in the month of December 2024. So these are the some of the examples, some of the case stories I am telling with you. It's my purely my personal experience and the personal cases which I want to share, that how the Daiva Vyapashraya Chikitsa, which is told in Ayurveda, how it will work in this Karmaja Vyadi. And this is a scan report of her, that endometrial polyp and bilateral cystic ovaries. And this is the no dominant follicle was coming in the beginning. And later, this is the scan report. And so there is no harm in believing the astrology, and whatever it is told in the astrology, many times it is true also. And all the classical references and our Upanishads and Vedas also tells that there is something beyond science that we have to accept. So whatever the science might have developed, but our Daiva Vyapashraya Chikitsa really work in case of infertility. And even certain regimens which are told in our classics, there is a definitely there is a role of Rajaswala Paricharya in improving the fertility. So Acharya Charaka clearly explains that the most important reason for Bija Dushti is not following Rajaswala Paricharya. Rajaswala is the menstrual period. So there are certain regimens which are told in our classics during the time of menstruation what has to be followed. So that definitely it will have an impact, and it will work for the proper growth and development of the bija. During Rajasrava Kala, the folliculogenesis will begin to happen. So as soon as the menstruation start, at the same time, even the folliculogenesis also will begin. So that is a period. If the dosha is vitiated during the first 4 5 days, then definitely there will be a bija dushti. That is what our acharyas told. That is why so much importance has been given to Rajasvala Paricharya. So what and all the things has to be done during the time of menstruation, that plays a very important role in case of a infertility patient if they are having any kind of bija dushtis. So following Rajaswala Paricharya since menarche, which will lead to the Shuddha Artava formation, which will prevent the Artava Dushti, which will prevent the Yoni Vapa, thereby prevent the Vandyatva also. It is a kind of Nidana Parivarjana Chikitsa, which is explained in our classics. And of course, the utility of Panchakarma, which is told in the classics, and the Vandyatva Chikitsa itself, which explains Snehana, Svedana, Vamana, Virechana, Asthapana, Anuvasanaihi, Kramashaha Upacharet, Maduraushada Siddhabhyam, Ksheeragrita Pushtam Purusham, Striyam tu Tailamashabhyam, Ityeke Satmi Reva Prajapatihi. So, in case of a Vandyatva Chikitsa, the first thing they have told that the Vamana Virechana and all the Panchakarma procedure has to be done. So depends on the patient convenience. We can select but practically all the panchakarmas. Going for a panchakarma, it is difficult nowadays. So if there is a bija dushti, you can select the virechana. If there is what a kshetra dosha, any kind of tubal block, then you can suggest uttarabasti. So if any obesity related issues are there, then you can see you can prescribe vamana. So depends on the cause, depends on the economic status of the patient. You can decide which mode of treatment, which panchakarma we can give. So definitely after the Shodhana therapy, which will increase the potency of the Shukra and the Arthava, that is very much required for the conception. And this is a case of Bija dosha, that is an ovulation. So with the irregular cycle, she was getting her cycle 45 to 60 days once, and she was having dysmenorrhea, stress, and the USG was suggesting anovulation with the hemorrhagic ovarian cyst was there. So it was an anovulatory infertility. And in that patient, we had given Deepana Pachana, Snehapana with Varunadi Grita, and Virechana with Trivrit Lehya and Drakshadi Kashaya, and Basti treatment, that is Mustadi Apanabasti was given, and Shamanaushadis was given Pushpadanvarasa, Shatapushpa Churna, Aloes compound. So the result is cycle was get regularized after the Basti treatment, and follicular development was normalized, and she was conceived after Basti. She was within 2 months she conceived and confirmed the intrauterine pregnancy, and her NT scan now it is normal. So how the there is a utility of Panchakarma which will help for the in case of a Bija Dushti. And this was her scan report before treatment. So there was a left ovarian dominant follicles, and which is telling that there is a hemorrhagic cyst was there. And ovulation was not happening in this patient even on the 23rd of her cycle. Even 23rd day she was not ovulating. And this is the present her NT scan report. So after giving Basti, so she conceived after 2 months, and this is a report, NT scan report. And another case where the patient was having a kshetra dosha, that is she was having a tubal block. So 26-year-old female, 4 years of married life, and she was having 3 years of infertility with a regular menstrual cycle, and no dysmenorrhea, and she was having a tubal block. So in that patient, we had given Virechana, Yoga Basti, Uttara Basti with Pipalyadigrita. So with Pipalyadigrita, we gave her Uttara Basti and then followed by the Shamana Ushadis. And so this is a report of that patient. So she was having left tubal block was there, and this is her 35 weeks 5 days scan report. So last month she delivered a male baby, and both are healthy. So this is all these reports and these cases showing how our treatment, how the treatment protocols which are mentioned in the classics, how beautifully it is working. So before coming to Ayurveda, they have tried. Usually patients, they will try everything and finally they will come to just to try Ayurveda, and after getting the success, they will be so much surprised because they will try IUI, they will try IVF, they will try all hormonal pills and hormonal therapies, and finally they will come to us. So, with all these treatments, also their problem will not be solved, and within 6 months, within 8 months, they can see definitely the lot of changes with our treatment. And even the Pumsavana karma also. So, we usually will practice even the Pumsavana karma. It is not only getting the desired sex of a child. So in the classic, it has given that Garbha Grahanartha, Garbha Sthapanartha, and Pum Jananartha. So Garbha Grahana. So in case of infertility patients also, this will help for the Garbha Grahana. So usually we'll do with Vatashunga on the day of Pushya Nakshatra, and then followed by we will do the Nasya Karma. So this is a case of infertility with the hyperprolactinemia case. This is also a case study, and so we have done the Pumsavana Karma with on the day of Pushya Nakshatra with the Vatashunga, and then followed by 7 days Nasya Karma was done with the Kshirabala 101 Taila, and then orally the Amrita Prashagrita was given, Saraswatarishta was given, and Alois compound was given. And this is a before treatment report. You can see the prolactin level was 46.9. And after Nasyakarma and Pumsavana, this is a follow-up one. So she was continued with the same medicines after the Nasya Karma. And on the second follow-up, she missed her periods. And she tested, and it came positive. And this is the current antenatal sonography of that patient. Now she is 7 weeks of 7 weeks and 4 days of pregnancy. So how beautifully the Pumsavana karma and the Nasya karma, which will help to in case of infertility. So the mode of action of Nasya is which will be absorbed by the pituitary gland, and active because of that there will be activation of the pituitary gland, and which will help to reduce the prolactin level, which in turn increases the GnRH pulse stimulation, and which will help to regularize the menstrual cycle, and patient will help to conceive. So this is the mode of action of Nasya karma. And even the Kshirabala Taila we have used, and it is having the property, so it is a Shukra Asrik Dosha Nashana. So any dushtis which is present in the Asrik and the Shukra will be corrected. So maybe this is how it will help to balance the hormones, and which will help to regularize the menstruation, and which will help to conception. And Amrita Prashagrita also, it is the indicated, it is mentioned as a Putradam. So the Falashruti of Amrita Prasha states that it is a Putrada. It also does the Vatahara, and it will enhances the Rasadhatu. So thereby it will help for the fertility and the conception. And even the Vedic Shamatva also has to be increased. That is also very important for the fertility. So with Basti and with the diet and the lifestyle modification and with the help of the Rasayana Dravyas, this Vedic Shamatva will increase. So there are specific Rasayanas usually we will prescribe like Sukumara Grita, Kalyanaka Grita, Brahmi Grita, which helps for the normalization of the endocrine secretions and which will help for the hormonal disturbances. And Ashwagandha, it is also a rasayana which corrects the irregular menstruation and helps to boost the day-to-day activities, and it will help to reduce the mental stress. And Shatapushpa Shatavari Kalpa, it enhances the follicular maturity. Falagrita, it corrects the hormonal disturbances. So there are many rasayana dravyas like Nashta Pushpantaka Rasa, Trifala Rasayana, Shilajatu Rasayana, Falagrita, Chandra Prabhavati, Brihat Shatavari Grita, Shita Kalyanaka Grita. So all these rasayana dravyas which will increase the Vedic Shamatva, which is very much necessary for the fertility. And even when explaining the Patya Patya, which is related to the fertility, they have in the Kashyapa Samhita, they have clearly mentioned that women who consumes Lashuna will never suffer from the infertility. So Amrita, it is considered as a Amrita for the female. So they have given that Shukra Shonita Garbhanam Jananam. The Lashuna is very good Rasayana Dravya, which is very much helpful for the infertility patient. Usually I will give in the form of kshirapaka, lashuna kshirapaka. So I will ask the patient to take in the follicular phase first 14 days lashuna kshirapaka. So just at home only the lashuna is available. Just 2-3 lashunas has to be taken and it has to be pounded well. Then it should be boiled in water, and again little milk has to be mixed, and again that also has to be boiled. So this at least daily in empty stomach 30 to 40 ml if she takes, it also helps for the fertility. And na jhatu bandyam. So in the classic it is given those who are taking lashuna daily will not suffer from the vandyatva, and garbham apnuyat. So it will help for the garbha. For the conception. And even Vardhamana Pippali Rasayana also, which will help those who are having immunological factors, immunological impairment, immunological disorders. So that also can be treated with the help of Vardhamana Pippali Rasayana. So it is the Falashruti tells that it is a Brahmana, Vayasthapana and Medya. So this will enhances, nourishes all the tissues, and that is very much required in cases of fertility. And for male also at the same time we have to treat, not only female. So depends on the cause, depend on the symptoms the patient is having, we have to decide. So in case of Bijopagata Jaklibia, they have given Vajikarana Chikitsa, Dvajabangaja, Pradeha, Parisheka, and Virechana Basti, Jarajanya Klaibia, Vajikarana Yoga, Yapana Basti, Rasayana, and Abhichara Klaibya, Daiva Vyapashraya Chikitsa. So these are the different modalities which is very much required to treat at the same time in case of infertility. And Achara Rasayana, this is also very important. This is nothing but what we can consider under Sattva Vajayam. So maintaining the behaviors. So that is also a very important to reduce the stress, and it will also help for the conception. So avoiding the krodha, himsa, that all will reduce the stress level. So indirectly it will help to reduce the cytokines kinase and cortisol levels. Thereby it will balance the stimulation of the hypothalamus, and thereby it will maintain the hypothalamo pituitary ovarian axis. So thereby indirectly it will help for the fertility. So finally I would like to conclude my presentation by telling that in Ayurveda, we have everything. Everything, whatever the modern science explained, the causes, the treatment, everything we have. It is 5,000 years back. Our acharyas mentioned, and beyond that, we have the Daiva Vipashraya Chikitsa, which is not told in the modern science. That is working very well in case of the fertility issues. So, Vandyatva is viewed holistically, not merely as a doshaja or the manasika vyadi, but also results as a karmaja or daivic influences. However, despite years of research and numerous advances in the field, still it is not offer any kind of guarantee in their success. And the food habits and the lifestyle, which plays a very important role for the infertility, which is told in our classics as a mityachara, ahara, and vihara. And integration of Daiva Vipashraya Chikitsa with the Yukti Vipashraya and Sattva Vajaya Chikitsa will give a complete comprehensive care in the reproductive care. Following the Shodhana Karma as a preconceptional care, following proper Rajasvala Paricharya, Dinacharya, Achara Rasayana, definitely it will help for having a Shreyasi Praja, that is noble, healthy progeny. So, with this, I thank everyone. And when the seen fails, the unseen prevails. Ayurveda teaches us to treat the soul as much as the body. So, that is very important. So, not only the body, Deha Shuddhi, even Mana Shuddhi, Atma Shuddhi is also important for both the patient and for the doctors also. Then only the success will happen. So, I take this opportunity to thank um, all the organizers and the Kamini madam for giving me an opportunity. Thank you, one and all. Namaste.
Thank you. Excellent, Doctor. Excellent. After so long journey of my webinars, after 2,700 webinars, really great. I have visited on behalf of Imami. I have visited more than 700 districts, but so many temples. Oh, great. If you are interested, we are conducting on every Tuesday medical astrology series. You are welcome in that.
Thank you, sir.
Excellent, doctor. Excellent.
See, all this is, sir, my the real cases, and it is practical because of the practical experience. So the treatment was given, and they were so happy, and because of them, I am also happy, sir.
Great, great. I am also practicing medical astrology from last 35 years. My grandfather was astrologer to Sindhia family in Gwalior.
Okay,
We
okay,
are
very
from
nice.
Gwalior. He was
Mm.
Rajvedya and Raj Jyotishi. So he tried to make me teach, but at that time, but now definitely. Thank you. Thank you very much. After long series of journeys on infertility, a new avenue you have opened. Great. Great.
Thank you, sir. I have not I wanted to tell my the experience more than the definitions or the which is present in the theory books, because everyone knows the theory.
Yes,
Everyone
yes.
can see now in the Google. So that is
Great.
why I have not explained much about the theory part. I have explained the practical aspect.
That's the unique USP of your presentation. That is the unique. That is the
Thank you,
unique.
sir. Thank you, sir.
ग्रेट मैं हमारे साथ बहुत एक्सपर्ट शुरू से जुड़े हुए हैं डॉक्टर अंजना जी वेलकम डॉक्टर अंजना सक्सेना जी डॉक्टर कामना गौतम जी जुड़ी हैं डॉक्टर अंजना जी जुड़ी है वंदना जी लेट आई हैं थोड़ी आज वसुप्रदा भी जुड़ी हैं ग्रेट डॉक्टर वसुप्रदा एंड कृष्णा कृष्णा मेहर इज ऑल्सो फ्रॉम स्टार्टिंग so if anybody would like to add anything as value addition, because madam has opened new avenue from Andhra to Tamil Nadu, Tamil Nadu to Karnataka, everywhere. Great. Anjana ji, Dr. Anjana
जी
madam,
सर जी सर जी सर
स्वागतम
नमस्कार सर
स्वागतम
नमस्कार सर जी जी सर रियली सर, बहुत बहुत ही कॉन्फिडेंट थी मैडम, और बहुत ही अच्छा बताया मैडम ने, और बहुत छोटी छोटी बातों पे बहुत अच्छे से ध्यान दिया। मैंने शुरू से सुना मैडम को, रियली
हाँ
बहुत प्यारा लगा उनका। और उनकी हर जो कहना चाहिए कि क्षेत्र, ऋतु, अंबु, बीज से शुरू किया मैडम ने। और जैसे जो कि आपने पॉइंट पकड़ा, सच में एस्ट्रोलॉजी और देव पाश्चात्य चिकित्सा में मैडम का जो बहुत ही अच्छा कहना चाहिए, उनको एक मिला है, इफेक्ट मिला है। और हम लोग भी सब जानते हैं कि करना तो सब उसी को है, भगवान ही सब करता है, हम लोग तो खाली माध्यम मात्र होते हैं और हम केवल अपना कर्म करते हैं। लेकिन मैडम ने जिस हिसाब से उसको प्रेजेंट किया है देव पाश्चात्य चिकित्सा के ऊपर, और इतने सारे टेम्पल्स को एक बार याद करा दिया सभी लोग को, तो मैडम को बहुत बहुत धन्यवाद। और रियली पेशेंट का बिलीव भी होता है भगवान पर, भगवान के बाद वो फिर हमारे पास आते हैं। और अगर हम उनको भगवान के साथ लेके चलेंगे और उनको बताएंगे तो ये रिजल्ट्स अच्छे आते हैं। लेकिन उसके अलावा भी जो अपने प्रैक्टिकल उन्होंने अनुभव बताए और पेशेंट में भी बताए, जैसे बीज दृष्टि में जो बताए, और इसके अलावा मेल इनफर्टिलिटी में भी बहुत अच्छे से योग बताए। तो ये रियली आज के प्रैक्टिकल में, आज की जो हम लोग ओपीडीज करते हैं, आज के जो पेशेंट देखते हैं, तो उनके जो प्रैक्टिकल अनुभव का हम सभी लोग बहुत अच्छे से लाभ ले सकते हैं। और रियली ये यूट्यूब आप सब शेयर कीजिएगा, इनका बहुत ही सुंदर था, बहुत ही प्यारा था, आवाज बहुत प्यारी है मैडम की, और बहुत फास्ट भी बोला, बहुत मैटर कवर किया और विद इन टाइम किया। तो नंबर वन पे रहा मैडम का, आज बहुत अच्छा रहा। थैंक यू
बहुत
सर,
बढ़िया,
थैंक यू।
बहुत 102 स्लाइडों से ज्यादा कवर किया है मैडम ने, गजब। वी
जी
आर
सर,
रियली
जी सर, और
कंग्रेचुलेटिंग
बहुत, हाँ, बहुत अच्छे से, जी सर, जी सर।
यू। डॉक्टर वंदना पाठक जी, डॉक्टर कामना गौतम जी, वसुप्रदा जी, डॉक्टर वसुप्रदा जी also, yes, welcome, welcome, your
Namaste, sir. How
valuable
are you?
comment, welcome doctor.
Namaste, ma'am. Rachana, ma'am, your presentation was so good. Like, it was so nice hearing the Veva Pashre again. Like, I just wanted to, like, I'm just an assistant professor. I'm just in the budding areas of my practice, but I have been, since, my family is, my grandfather, like sir said, my grandfather was a Shiromani, and he's a double gold medalist in the British period. So I just wanted to continue his lineage. So I just wanted to ask you something. Like, I have a doubt. I'm just in the budding areas of the practice.
Yeah, yes,
So,
madam.
like, how do you, like, I also, whenever I get infertility patients, I try to convince them to first see astrology. Like, since the first consultation, I just ask them to get an astrology consultation, and then for the second consultation only, then come back to me. Because, like, as you said, it's a karmaja vyadhi, and because, like, that has to be treated first, and then only, because that is the first nidana. And nidana parivajana, as an Ayurvedicians, we first believe that, right? So how do you convince some patients are so lost interest in any Daiva Vyapashraya things, and then they come to medicine? So how do you convince those kind of patients? Or sometimes, like, it is awkward in village, it's fine, like we can ask patients, like, you do go and come, like, we can tell something. In cities, especially with the Gen Zs and the late millennials, convincing them to do all these things is very difficult. So I just wanted some tips from you. So thank you.
We have to see the patient, ma'am. First, we have to decide in the first, as you told, in the first visit only many will not agree. And I will see the patient. I will see their background also, how many treatments they have taken, and their frustration level also. If they are more frustrated, definitely they will agree, madam. So if the married life is only 3 4 years, then they will, for such kind of patient in the beginning, even I will not tell also. So those who have finished
Okay.
everything, IUI, IVF, and even they will go to at the level of adoption. So for
Adoption.
such patient only I can tell in the beginning. So other patients after 2 3 visits only, or after 6 months, first I will try with our Shodhana Shamana procedures, and then even it is not responding, then only I will suggest in such cases Daiva Vipashraya Chikitsa. Because for all patients, definitely we can't tell also, and we can't convince also. So depends on the patient's background, depends on the patient history, depends on the married life, life depends on the cause. Especially in the unexplained infertility cases, they will do, madam. They will go for astrologer. If they know the
Huh.
cause, then they will not believe. They will tell that first you treat this one, then we'll do that.
Exactly, ma'am.
Ah,
Huh.
so depends on the patient. We have to decide and we have to advise. So for all patients, in the beginning, in the first or second visit only, we can't convince.
Okay.
Great.
Ma'am, thank you, ma'am. It was very informative. One more thing I have, have you ever found like this nidana, say like tubal block is because of more like sarpadosha or streaky ovaries, sorry, tubal streakiness and those kind of is because of sarpadosha and endometrial hyperplasia or those kind of things is because of this dosha. Have you any able to what categorize anything
Ah,
like that?
no, no. Now I have in my list around 25, 30 cases, success cases, madam. So I actually, for getting the statistics, at least 100 patient success patient is required. So then only I can categorize whether it is because of Sarpa dosha, whether it is because of Shani dosha, whether it is because of any other graha doshas. Then only I can categorize. So now collecting the data is difficult with minimum number 20-25 success rates with the Daiva Vyapashraya Chikitsa. It is difficult. In future, anyway, I'm collecting all the data. Maybe another after 10-15 years, I may get some more collections and then I can finally assess the things which because of which dosha, which pathology is having. But in
Sure,
the
ma'am. I
astrology,
would.
it is clearly told, madam. In eighth graha, during the time of marriage, in the eighth house, if Mars is there, then she is not having the child. So that is all actually true. I have seen that thing, whatever it
Yes,
is told in the medical astrology, that is true,
it's
madam.
definitely true. Yes, ma'am.
It is true because I am
Because
observing that. I am observing that,
yeah,
and I'm collecting the data also.
because we have to be convinced to convince the patient. So it is really miraculous seeing all those things which have been priorly told, and they are working. They are like almost what we can say prophecies. We can say. I don't know. It's so nice. Thank you, ma'am.
Thank you, thank you.
With your kind permission, can I add something in Davyapasra Chikitsa? I
Yes,
am
sir.
practicing medical astrology right from 35 years in Calcutta. Now I am in Bhopal. Three things I have observed. Number one, if a patient is keen to have the result, whatever the result may be child or maybe disease-free life, then only Davyapasra Chikitsa works, number one. Number second, it is not a matter of Pandits, which you have selected 13, 14 Brahmins, they are just reciting slokas, nothing will happen. The patient should recite the sloka, for which I am prescribing for chronic diseases mantra dhara. This mantra dhara is a transistor type box of rupees 200 or 250 available on any online stores. They have fed 25 or 30 slokas in that transistor. You can select any one of sloka that will be continuously reciting in your home in slow volume. Mrityunjay mantra with Samput or like your mantras of any childhood. I don't know. But those mantras should be recited by that machine in low sound. So patient will be reciting unwantedly. They are not desiring to recite, but if a transistor is continuously singing that slok in your room, definitely you have to recite that, chant that along with that. So that is very important. And number three, this fifth house, fifth and seventh house. This is two houses are important with context to the husband-wife relation and the child in their fate. Both. Vidya Santati is related to fifth house and seventh house is of spouse. So both the houses to be taken care of I am confident that if a patient is desiring to have the result, they will have result. Definitely they will have result. Anybody else? Deepika ji,
Thank you, sir.
Kamna ji, namaskar.
नमस्कार डॉक्टर नमस्कार।
नमस्कार, नमस्कार।
हाँ जी, हाँ जी। नहीं, मुझे बहुत सुनने में अच्छा लग रहा है। बहुत सही अच्छा बता रहे हैं आप। बस नहीं बोल सकती हूँ। और डॉक्टर साहब ने भी बहुत अच्छा बताया दिव्यापाश्रय चिकित्सा के बारे में।
जी,
बहुत सही लगा।
बहुत अच्छा। और अगली वेबिनार हमारी और भी अच्छे टॉपिक पे है। टुडे इज वर्ल्ड साइट डे, हाउ टू
हाँ जी,
इम्प्रूव योर साइट। So we will have Sangeeta Bhadraji. Dr. Sangeeta Bhadraji is ophthalmologist in our medical college, Mansarovar Medical College. And
हाँ
then
जी,
two Ayurvedic Shalakya experts will also guide us in next webinar. Welcome, Sangeeta ji. Only 5 or 7 minutes. Welcome.
हाँ जी, बढ़िया।
तो कामना जी हैं, रचना जी से हो गई। दीपिका जी, वुड यू लाइक टू से समथिंग? आज कामिनी जी बेचारी अटक गई, बोल रही थी। दीपिका जी, वेलकम।
हाँ सर, एक्चुअली हमने बहुत लेट ज्वाइन किया आज 9 o'clock को, तो हमने
तो
थोड़ा
और
बहुत
अच्छा है,
केस
मंत्रों की
डिस्कशन
बातें ही हो
में
रही थी उस समय।
नहीं, हम वो यूट्यूब में दोबारा देखेंगे। इतना सुना प्रेजेंटेशन के बारे में, अब तो देखेंगे दोबारा
जरूर
यूट्यूब पे
देखिएगा,
फॉलो
जरूर
करेंगे।
देखिए। आज का बड़ा शानदार
ठीक है सर।
प्रेजेंटेशन भी था और स्पीच भी बड़ी शानदार थी।
ओके, ओके सर, थैंक
थैंक यू, थैंक यू। मैं तो अब प्रार्थना करूंगा, जुड़े रहिएगा। डॉक्टर किरण पटेल आयुर्वेद से आ चुके हैं, शाला के एक्सपर्ट हैं कोल्हापुर में। और डॉक्टर संगीता भद्र जी हमारी पूरी ऑप्थेल्मोलॉजिस्ट हैं, डिपार्टमेंट संभालती हैं, सर्जरी करती हैं। बहुत मतलब वो यंग लगती हैं, लेकिन वो इतनी एक्सपर्ट हैं कि उनकी यूथ से ज्यादा एक्सपर्टीज है, मैं तो ये कह सकता हूँ। रियली ग्रेट। थैंक यू ऑल, बट वी प्लीज स्टे विद अस, क्योंकि हम लोगों की सबकी वो उम्र है जिसमें आंखों की रोशनी तो बढ़ना चाहिए। इतना स्क्रीन टाइम हो चुका है, तो प्लीज अलाउ मी फॉर 1 minute ओनली। आई एम चेंजिंग द लिंक ऑफ द वेबिनार। जस्ट 1 minute।
अच्छा।